I first got involved in HIV prevention back in 1995. I was doing an unpaid internship at St. Louis Effort for AIDS in St. Louis, Missouri, and it really was part of my coming out journey. I was trying to find my place in the world, my sense of identity, and then after that time decided to make my way out to San Francisco, and I've been working more specifically in the Asian, Native Hawaiian, and Pacific Islander HIV and broader health movement ever since. I came out in St. Louis, Missouri, in the middle of the Midwest in the mid-90s. And at the time, there weren't a lot of out LGBT ANHPIs that I saw in the surrounding community. One of the most difficult pieces that I experienced in St. Louis was not feeling that how I looked, my skin, my face, my body, that I didn't feel attractive to the community around me. It wasn't people who looked like me who were cast as the romantically or sexually desirable. When you don't feel that you're attractive, when you don't have a sense of pride, when you don't feel that you are, that you deserve to be loved, the few friends I had who were gay and Asian, I think that was a universal experience for us, that to have someone want to date us or want to be in a relationship with us sometimes caused us to perhaps not be as safe as we needed to be. The term that's often used to describe our community or to categorize our community is API, Asian Pacific Islander. At my organization, we're really conscious about including Native Hawaiian in that as well, because we've heard from members of the Native Hawaiian community that by not including the NH or the Native Hawaiian, that we're contributing to the invisibility of their communities. And that's why we use the term AANHPI, Asian American Native Hawaiian Pacific Islander. That term itself represents over 50 different ethnic groups that speak 100 different languages and dialects. And it includes groups that have a long history here in the US and in turn thus have large population sizes. So groups like Japanese, Chinese, Korean, but it also includes groups who are newer arrivals to the US, groups like the Hmong population, the Bangladeshi population, the Chamorro population, groups like Samoans, folks from the Marshall Islands, from Palau. And that diversity of our community, I don't think is fully appreciated by policymakers, by programs, by health departments, by decision makers. So many of our nation's decisions about where resources should flow, where attention should be paid, is based on numbers. It's based on surveillance data. And if the numbers in any particular group are too small, so often what we see is that there isn't sufficient priority or resources that are given to those specific groups. So by bringing the 1 million Asian American Native Hawaiian Pacific Islanders who live in the US under this one umbrella, not only for HIV, but for TB, for hepatitis, for so many other health issues, it gives us a critical mass to show our importance to our country's decision makers. So the numbers of ANHPIs who are diagnosed with HIV have definitely continued to increase since the beginning of the epidemic. Each year, about 1,000 ANHPIs is diagnosed with HIV and AIDS. We also know that there are about 16,000 ANHPIs who are living with HIV/AIDS. 1 out of 5 individuals who are living with HIV/AIDS aren't aware that they are. And that just reinforces the need for continued prioritization of resources and attention for prevention and testing programs for our communities. Over 2/3 of the Asian American Native Hawaiian Pacific Islander community are foreign-born, and because of that, so many members of our community actually speak a language other than English at home, or may have limited English proficiency. That's why it's incredibly important to ensure that materials are translated into Asian American, Native Hawaiian Pacific Islander languages, or that interpretation services are available. The reality, though, is that the resources that flow to our community for HIV prevention, care, and just isn't sufficient to be able to do the translation across all of those different languages and dialects. So one of the things that we encourage health departments and different aid service organizations and hospital systems to do is to look at census data and identify what are the largest ethnic groups that exist within your particular geography, and to also look at which are the specific ethnic subgroups that have the highest rates of limited English proficiency. And that gives you an idea of how to target the limited resources that you might have for interpretation or for translation. Some of the perhaps unique pieces of how HIV impacts Asian American, Native Hawaiian, Pacific Islander communities is the level of stigma that still exists within our communities about talking about sex or talking about injection drug use or the different ways that HIV is transmitted from person to person. There's also still such a huge level of stigma that exists for people living with HIV/AIDS, as well as around gay issues. I think it makes it that much harder for us to negotiate safer sex or to talk about sexual history with our partner or with our partners. And that is something that I know a lot of Asian American, Native Hawaiian, Pacific Islander prevention programs have tried to incorporate into our prevention programs and our prevention messaging, the importance of talking about these often taboo topics. Shame and saving face are a part of so many Asian American, Native Hawaiian, Pacific Islander cultures. I know in my own personal coming out journey, that's what made it so difficult for me to come to acceptance about my gay identity. One of the things that I was really worried about was losing the support and the connection to my family. And when I finally did come out to them in my early 20s, it caused a rift in our relationship that lasted for many years. And I think that that is the fear that keeps many individuals who are either LGBT or living with HIV/AIDS in the closet and not disclosing their status to the people around them. So there's this model minority myth that I think applies mostly to the Asian American community, and that model minority myth is that all Asians are universally healthy, wealthy, and educated. It makes it that much harder for all of us advocates who are trying to ensure that our communities are served to get the funding to those organizations who are specifically targeting our community. I think the other nefarious piece about the model minority myth is it actually is used so many times as a wedge between Asian American communities and other racial ethnic communities, other communities that we actually should be aligned with and whose journeys in this country are closely interwoven with our own. I've had the opportunity and the privilege to work in HIV prevention and broader health issues across the US, as well as the 6 US affiliated Pacific Island jurisdictions. And the one thing that I've found universal is there is this sense of making sure that our communities aren't left out and forgotten. The most important fact about HIV in Asian American, Native Hawaiian, Pacific Islander communities is that there is an impact. So often what happens is in surveillance reports and in epidemiologic profiles, the data about our communities is made invisible. It's either lumped into an other category or it's completely missing from the tables, charts, and graphs. And unfortunately what that does is it perpetuates this misconception that our communities aren't impacted at all by HIV and AIDS.